All right, everybody. Good morning. Welcome to today's webinar. Happy Friday. We're happy to have you guys here. We got more snow yesterday, so I hope that you guys are all doing okay, staying warm, staying dry out there. But we're happy to have you guys here. We're happy you joined us. And so just to get us started, we're going to go over a few of the logistics for today. As I know many of you are used to this at this point, but we're just going to review them just in case. So as always, we'd love to hear from you in the chat. Please feel free to use the chat to type your questions. We want to hear from you, want to hear how things are going. You can also say hi. You're also welcome during the presentations at appropriate times to unmute yourself and to ask your question that way. We definitely want to hear from you, hear what's going on. We do ask, however, if you are not presenting or actively asking a question, that you keep yourself on mute just to minimize background noise. If you accidentally get unmuted, I will just go ahead and remute you to keep that background noise at a minimum level. But we do want to hear from you. So definitely don't hesitate to let us know if you need anything. And then as always, just want to share how grateful we are for you and all the hard work that you're doing. We're coming up on a year since the pandemic started. It's been an exhausting year. And so we appreciate all of you hanging in there with us, continuing to work to do your best to help us keep clients safe. And so we really appreciate you. And with that, I'm going to go over our agenda for today. So we're going to have several things that are pretty common for us. We're going to start with some shelter updates. Then we're going to give a couple system-wide updates. We've got a couple resources that we want to share with you guys. And then we're going to end it with we're really excited to have an opportunity to hear from folks at the CDC. And so they have been gracious enough. They are here in Detroit right now, and they've been gracious enough to agree to talk to you guys today. So we're going to try to give the bulk of our time today for to hear from the folks at the CDC and to also allow some time for some robust questions and answers back and forth. So we're really excited about that. So with that, I am going to turn it over to Lauren. Oh, sorry, I had to sneeze. I'm going to turn it over to Lauren Licata, and she's going to give us some shelter updates.
Thanks, Katie, and bless you. So I'm Lauren. I am from the city of Detroit. We just have a couple really quick shelter updates today. We are back down to 0 positive clients in shelter type 2. So we were at a time when that shelter was pretty much almost full. And that was about a month or so ago. So now we're back down to 0. So great job, everybody, for helping to mitigate the spread. Next, oh, perfect. Vaccine distribution has started in congregate shelters, TH, PSH, and unsheltered programs. The first dose was given on January 13th. As of right now, 20 facilities have received the vaccine, and over 230 vaccines have been given to clients. I do want to preface that number saying that we're still waiting for some of the data to come in. So that number is actually probably much higher than that, but we're still just waiting for some of the data to roll in. DHD will be doing the scheduling. You'll most likely hear from Lauren Payton from the health department to schedule your vaccine date. And then we are asking that you have clients complete the HMIS ROI for the vaccine so we can track it in HMIS, and then make a copy of the vaccine card and email both of those to myself. I can also plug my email into the chat box, and there's a link here for the HMIS ROI as well.
All right, wonderful. Thank you so much, Lauren. Those are great updates. Now we're going to transition into our system updates. And so the first one, I'm going to turn it over to, I believe, William. And William's going to give us a couple of updates about HMIS.
Thank you, Katie. So, as of today, so next week is the time that our boot camp will be happening for the HMIS. And we have the sign up, everything on our website. You should have gotten an email with an explanation of all the the sessions and what they're for. And right now we have around 79 people signed up out of like 300 people that we sent the email to. And when you're signing up for these trainings, remember that some of them overlap with each other, because some of them are meant for certain providers, some of them are meant for other providers. Like you have emergency shelter trainings, you have a shelter outreach training, you have a rapid rehousing training. So it's one of those things that we advise you to do is look at the details of the training. So to see if you actually need to go to that training, because some of them do overlap. So there's like 2 trainings on February 25th that are at 9:30 and they're simultaneous. So one is for emergency shelter, another one is for something else. So please look at the times that those trainings are, and then which trainings that would benefit you the most with what you're doing, like street outreach, emergency shelter, rapid rehousing, transitional housing, whatever needs to happen. So you can go to so we have a web page for it. It's right here. The link is right there. And then what you need to know is Hand is utilizing the signup.com platform. So we have the signup.com platform, and then we have you can sign up on our web page as well. So the deadline for signing up is Tuesday, February 23rd. So we want to be able to know what's going on. So we can see how many people are coming, what we need to prepare for. And then prior to the event, you'll be notified with the individual session links. Once the webinar times arrive, just click the link for the session and join. So after each one, after the whole entire event itself, you're going to be given a follow-up email with an evaluation survey. Please fill out that survey. So if we do another boot camp in the future, that we can make it better for you. And so please do sign up. The deadline is Tuesday, February 23rd at 5 p.m. And we send it to over 300 people. So we want more people to come join and learn more about the system itself. And then the last thing is the pick and hick. So if you have not sent me your APRs for emergency shelters, safe havens, and transitional housings, please do so. I need to run reports accordingly so that when our one-on-one meetings happen, that we can have a good meeting and a productive meeting. And so with that, basically the one-on-one meetings will be starting the first week in March, and you'll be getting signups for that coming in the next week. So please be on the lookout for those. You'll be able to sign up for 30-minute, 1 hour, and it depends on how many, say, projects you have within your provider mix. So if you have one project, you'll probably get a 30-minute sign up. If you have maybe 6 projects, you'll probably get a 2-hour sign up. It just depends on what we've delegated for your individual providers. But that is it for me, Katie. Thank you.
Wonderful. Thank you, William. Deja, I saw you mentioning in the chat that you were wanting to get an email. William, I know you had mentioned you emailed this out to about 300 folks. If folks on this webinar didn't get that email but are interested in it, would you want to pop your email into the chat for them to reach out to you, or do you want them to pop their email in and you'll forward it to them? What would work best?
Yeah, I can put my email in the chat. And she said no, the link for the ROI.
Oh, okay, perfect. But you could still do that just in case there's
yes.
Maybe. Perfect.
For sure.
You.
So yeah, if anybody needs to email me that they didn't get the link or whatever needs to happen, please email me and I'll make sure to get you on the list to email you that link as soon as possible.
Perfect. Okay. Thank you so much, William. All right. Lauren, I think you kind of briefly addressed this when you were talking about vaccines, but do you mind just giving folks a little bit of an update on how advocacy has been going to get vaccines for our frontline housing staff?
Yeah,
Thank you.
Okay. Yeah, of course. So we've been advocating pretty hard to get frontline staff vaccinated with our PSH rapid rehousing program, some other programs that we may have missed the first round. So I received notification yesterday that they have expanded the sites that they are going to vaccinate, and that would include PSH and rapid rehousing. However, I'm not sure what list they are working off of, so I'm waiting to hear back from them so they can provide me the list so I can provide them with the correct list of providers that we have that HAN has provided me with. So hang in tight there. We are working hard to try to get everybody in to get vaccinated, to get all your staff and your clients vaccinated.
Perfect. Yeah, thank you so much for that update. So Exciting news. It seems like we should be able to get these vaccines coming to you guys very shortly so that all of you guys who are engaging directly with clients can be vaccinated even if you're not working in a shelter. So we're really excited about this update. We'll continue to keep you posted and continue to watch your emails too for folks from the health department to reach out to you to schedule vaccines as well. So with that, we're going to transition now to talk about a few resources we want to make sure are on your radar. So the first thing is we just wanted to make sure you're aware of who all is eligible to get vaccinated at TCF. And so on the left of this slide right here is a flyer that the health department created to show who is available to be vaccinated right now in the city of Detroit. And so it shows all the different categories of folks who are able to get vaccinated. And then on the right of the slide, we've got information on how to schedule appointments. So you do that by calling the number on the screen. You can call them at any point from Monday to Friday between 9 a.m. and 6 p.m. And then they'll work with you to schedule a time to go to TCF and get your vaccine. And we also put a link here because this information is changing so rapidly. While we posted it on this slide, it's very possible it could be updated today or tomorrow. And so this information is really not static. They continue to add categories who are eligible. So we really want to encourage you to go to the website, which we've got linked in this slide, and I will pop it into the chat as well. And so, we really want to encourage you, though, to continue to check that website to see new updates. We also want to encourage particularly our PSH and our rapid rehousing providers, our providers working with clients in scattered site locations who are not at the shelters. We really want you guys, really encourage you guys to monitor this list and to work with your clients to determine what categories they fall into. So monitoring it for when your clients become eligible. And then we really want to encourage you to work with clients to help them get scheduled for vaccinations at TCF and to obtain those vaccinations, whether that be by transporting them, coordinating transportation for them, providing education to them on vaccines. We also really want to encourage you to share the resources we've shared with you about vaccine education with clients so that they can make an informed decision once they are eligible. They can decide whether or not they'd like to get that vaccine with as much information as possible to guide that decision, and then that you guys would be there able to help them as well to obtain that. So just really want to make sure that this stays on your radars and that you're partnering with clients in this endeavor. So I believe I just popped the link in the chat. That looks like a weird link though. So, yep, okay. That's the link, but then I messed up. Okay, perfect. All right. Okay, and so then this next slide here is just a little bit more detailed information about who's eligible, like a little bit more expanded information on who's eligible at TCF right now. Again, we do encourage you to go to that website though for the most accurate and up-to-date information, but we just wanted you to have as much information about what's the case right now as we have currently. This next resource we wanted to share with you, we are now in tax season, very fun time for most of us. And so we had just wanted to share some tax filing resources with you all that you can, of course, use for yourself if this is helpful. But particularly, we want to encourage you to help clients who may have taxes that they need to file for, to help them file their taxes and to link them with these resources if they need assistance. We recognize that you are not tax experts. We are not asking you to be, but we do just want to kind of gear you up with resources around taxes so that you can have them at your disposal to help for clients. We are also working right now to try and partner with folks at one of the assistance agencies that are listed on here to see if we can get any training in relation to helping clients file taxes or just have a working relationship with them. I believe we haven't heard back from them yet, but we will keep you posted if we have any more information that we can share with you all about this. And then the last resource, actually the second to last. So we shared this at the last webinar. We just wanted to make sure it stayed on your radar that there are vaccine education printouts available for you that you can print out, hang up in your different facilities, pass out to clients, and use these as tools when you're educating clients about vaccines. And so we just wanted to make sure that you were aware of this and continued to utilize this resource. So these are in the folder for the February 5th webinar. And you can access these, download them, print them, do whatever you'd like with them. And then the last, for real, the last time, is we just want to keep it on your radar. I know we've talked about this a few times, that we just ask that you continue to work with clients to help them get their stimulus checks. We just want to link you to the Poverty Solutions website. They have a comprehensive guide on helping folks determine if they were eligible for the stimulus checks and check where the status of their stimulus check, and then advice on what to do if you haven't received it yet. So just want to make sure you're aware that this resource is available to you and hope that you're utilizing it. And so with that, now we are going to turn over to the bulk of our presentation today. We're going to turn it over to folks at the CDC. I believe we're going to be hearing from Michael Yeh.
Yes, thanks, Katie. Good morning, everyone.
Hello, good morning. We're so
Hi.
glad to see you.
Yeah, if you're able to stop sharing your screen, I think I'll be able to pull up my slides.
Perfect.
Okay, let me switch over here. Okay, great. Can everybody see the slides?
Yes.
Okay, thanks. So again, yes, thank you very much for the invitation. My name is Michael Yeh. I'm a physician with the CDC team that is working with the Detroit Health Department this month. My background is in emergency medicine and internal medicine, and it has been a great pleasure to meet some of you during our site visits this month. I have to say you are doing some truly incredible work here in Detroit. So today I'd like to talk a little bit about how you can prevent and control the community spread of COVID-19. Now, many of you have heard a lot of this in some form already. I won't spend too much time telling you how to wash your hands or wear a mask or stay 6 feet apart. I know we've all heard that before. However, I'd like to go over a few specific measures that you can take to help limit transmission as much as possible in your facilities. All of the resources I'll discuss today are available on the CDC's website. After this session is over, I can also send you an email with links to the relevant documents, so you don't have to worry about trying to write this all down right now. So this is a general overview. I'll just go over some basic background on COVID-19 in general, talk about planning and partnerships for homeless services, and it seems like you've done that really well in Detroit so far. We'll talk about some specific things you can do with a facility's layout, screening for symptoms among the clients, things to consider regarding cleaning and disinfection, and then we'll just leave some time for discussion. So as most of you know, COVID-19 is caused by a virus, the severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, which can be spread from person to person. Someone can become infected by coming in close contact with another infected person's respiratory droplets or by touching a surface that has virus on it. Symptoms of COVID-19 can range from mild to severe illness. Typically, the symptoms appear between 2 to 14 days after exposure to the virus. So you can have constitutional symptoms, which are things like fevers or chills, just feeling really tired, fatigue, or run down. You can have respiratory symptoms such as cough or difficulty breathing, Some people report having cold-like upper respiratory symptoms like a sore throat, congestion, or runny nose. Some people also have muscle aches, body aches in general, headache, loss of taste or sense of smell, or gastrointestinal symptoms like nausea, vomiting, and diarrhea. However, it's also important to keep in mind that some people do not have any symptoms, and asymptomatic people, as well as people who are initially okay and eventually go on to develop symptoms, can also transmit the virus to other people before they even feel sick. Everybody is at risk for getting COVID-19, but there are some people who may be at higher risk. These include older adults and people with serious underlying medical conditions. Some of these medical conditions include cancer, chronic kidney disease, chronic obstructive pulmonary disease, such as emphysema or chronic bronchitis. Down syndrome was more recently added to the list of comorbidities as well. Chronic heart problems, such as congestive heart failure, coronary artery disease, also place people at greater risk. People with weakened immune systems from solid organ transplants or HIV or any other reasons are also at higher risk. Other conditions that affect how people do with COVID-19 include obesity, sickle cell disease, pregnancy, and type 2 diabetes, among others. In addition to these chronic medical conditions, cigarette smoking or any tobacco smoking is also a risk factor. There are some basic ways to prevent exposure, including avoiding close contact with other people and wearing a mask, either a surgical mask or cloth mask, in a setting where other people are around. So this, of course, would include most areas and shelters where people congregate. The original guidance mentioned a cloth face covering, but I understand that the supplies that many of you have received include disposable surgical masks, and those are perfectly appropriate to use. We also recommend checking that the masks fit snugly over your nose, mouth, and chin. So one way to do that is to cup your hands around the outside edges of the mask and just make sure that there aren't big gaps where air is flowing from the area near your eyes or from the sides of the mask. There has also been a lot of talk lately about the so-called double masking. You might have heard about that in the news. And actually, I'm going to pull up another document here. A second. So the CDC recently came out with updated guidance to improve the fit of masks. So this document here that I'm showing on the website is available. If you hit the print button, it actually prints this all out into 2 neat pages that you can also post in the facility as well. And I'll provide you with the links after this call is over. So first, I mentioned making sure that the mask fits snugly against the face. And then down here, you can see to improve the fit of the mask, you can add layers of material. So one way to do that is to wear a disposable surgical mask and then use a tighter fitting cloth mask over the top so that it pushes the edges of the inner mask against your face. We actually do not recommend wearing 2 surgical masks because they're really not designed to fit tightly, and just putting more than one on really does not improve the fit. Another way, if you don't want to do the 2 layers, another way to improve the fit is the so-called knot and tuck technique. So it involves tying a knot in the ear loops on both sides where the string joins the edge of the mask, and then tucking the edge over. I can just take a moment here to show you this video from the University of North Carolina that goes over how it's done. Okay, so you can see the way she tied the knot right against. Oops. Oh, sorry. Sorry about that. So you can see the way she tied the mask really makes it snug against the side of the face. And we will send you the link for that as well. Hand washing. So you've all heard about this. We just recommend that you scrub with soap and water for 20 seconds. And that's probably the hardest thing to remember. 20 seconds actually is a long time if you actually take the time to count. Some people find it helpful to sing a song, such as a birthday song or alphabet song, to help keep track of time, as long as you know that it's about 20 seconds long. That helps ensure that you are scrubbing for an appropriate length of time. Also having alcohol-based hand sanitizer that contains at least 60% alcohol out and readily available and visible to all of your clients can also encourage use, and also remind people to avoid touching their eyes, nose, or mouth. And actually just wearing a mask can also help remind us to not touch our faces. The next part goes over planning and partnerships for homeless services. And this is just to show you that the CDC has many resources available online that pertain specifically to services for people experiencing homelessness, including preventive measures that can be taken in shelters and other shared housing environments. So I won't pull up all of these documents right now. As I said, I will email you with links to the most recent versions, but this is just to show you a glimpse of what's available. We'll also send you links to educational materials such as flyers and signs that you can also print and post at your facilities. So we visited several shelters here in Detroit this month since we've been here, and we have been very impressed with the critically important work that you are doing for the community. As you all know, it's very important to continue providing homeless services during the pandemic. People experiencing homelessness are at risk for infection with COVID-19, and we want homeless shelters to remain open and available to people who need services and a safe place to stay. We do not recommend trying to exclude people who are having symptoms or test positive for COVID-19 without a plan for where these clients can get services safely. And it seems like through what you're doing with CAM and HAND and the quarantine shelter that's available, it seems like you have a solid plan for doing that. And of course, we recommend coordinating with local health authorities when making decisions about quarantine and isolation. We also see that you have a good community approach in place, looking at the partners on this conference call this morning. So a community coalition can include city agencies like the Housing and Revitalization Department, the Detroit Health Department, CAM, HAND, health systems like Henry Ford, and other organizations that operate shelters and provide other services. Again, if you would like further information about this, it is available on the CDC site, but it seems like you already have a lot of this structure in place in your community. And again, this also goes over things like quarantine sites and overflow isolation sites, which you also have. I'll go over a few things to consider regarding a facility's layout and procedures. There are several ways that you can reduce risk of transmission by making changes to a shelter's layout. We recognize that sometimes you might be limited by the amount of space that you have or physical features of the building that you're in that might make it hard to move things around. If possible, you can consider using physical barriers in certain areas. For example, one common area would be the main entrance where clients check in. Some people are using plexiglass barriers to protect some staff members who interact directly with clients with unknown infection status. During meal times, it's important to make sure that people in dining areas are physically distanced from each other with at least 6 feet of space. Sometimes having staggered meal times can help with that. Another option is to have the food given to clients to eat elsewhere, such as in their rooms or in other separate places, so that not everybody is taking their meal close together in one area. There's one other thing that you can consider in shared sleeping areas, such as dorm settings. We want to make sure that the client's faces are at least 6 feet apart, especially since when you're sleeping, it would be hard to wear a mask when sleeping. So we recommend spacing the beds apart at least 6 feet, and also having clients sleeping in a head-to-toe configuration, which can create extra distance. You can see in this diagram on the left, if you have people kind of lined up in a row, it's easy to see how you can do that. But if you have beds that are adjacent to each other in this format on the right, you can have one person with their pillow facing one side and the next person with their pillow on the opposite end, and just staggering it out like this. It just creates extra space between the beds and between people's faces. This guidance here is for facilities that need to create an area to house clients with mild respiratory symptoms. So again, we can talk about this in more detail if anyone wants, but in Detroit, you have a process to send symptomatic clients to the quarantine and isolation shelter for further testing and care. So most of this would not really be applicable. We do recommend having a dedicated isolation room that's away from other clients and staff when you have someone who is waiting for transportation to the quarantine site. Ideally, if you can give that person a room with a separate bathroom that no one else is using, that would also help minimize the risk of transmission as well. And also making sure to clean that area thoroughly after that person has left. And again, for clients with confirmed COVID-19, it would also, this would pertain more to the quarantine site itself. But for most shelters, it would involve calling CAM, isolating the individual, and waiting for transportation. And again, we kind of touched on this earlier, do not require the negative COVID-19 test before you do the intake and speak to someone, and make sure that you have a plan for a safe disposition for them. Make sure bathrooms and sinks are stocked with soap and hand drying materials for proper hand washing, and to make sure that you're providing alcohol-based hand sanitizers at key points inside the facility where areas that are where many people traffic. And one thing we would like you to do more frequently is to assess clients and staff for symptoms. I know that's already being done at the intake process in most facilities. We'd like to encourage you to also try to speak with most people regularly to do that. And we'll cover that in a slide later on as well. And again, keep in mind that some people might have COVID-19 without showing any symptoms. So just try to think of physical distancing and ensuring that everybody wears a mask at the facility at all times. So moving on to ways you can help the sick clients. It is pretty important to identify anyone who is feeling sick as soon as possible to help prevent spread in your shelter. I understand that many of you are using a standard intake form provided by CAM that has questions about symptoms when a new client arrives at the facility. But we would also like to encourage you to check on all of your residents at least once a day, just see how they're feeling, ask if they are experiencing any symptoms. The health department's nurses that are visiting the shelters have been asking clients about their symptoms when they visit and do their testing, but we also want you as staff members to feel empowered to screen your residents regularly. We trust that you know your clients better than most other service providers that they encounter, and they might also have more trust in you as well. They might be more likely to come to you and confide in you when they are not feeling right, and you can also tell better than anyone else if a client just doesn't look like their usual self. So the first step is to determine if the client has a fever. If you have a thermometer, you can use a thermometer according to your usual practices, and also just ask them straight up, have you felt like you've had a fever in the past day? And for the other symptoms, we do recommend going through the questions in a methodical way, such as asking about these specific symptoms, using the standardized CAM intake form. But other symptoms asked about include shortness of breath, fatigue, muscle or body aches, headache, new loss of sense of taste or smell, sore throat, runny nose, congestion, nausea, vomiting, or diarrhea. Also, I do like to ask if someone has a new or worsening cough, and not just saying, well, are you coughing? Some people, especially people who smoke, might have a chronic cough. It's the usual for them. So if you ask, do you have a new or worsening cough? That also helps them distinguish versus between what they normally have versus a new symptom. If someone has any of these symptoms, provide them with a mask if they're not already wearing one. Then isolate them in your designated area, advise them on cough etiquette, so covering their mouths, providing tissues and trash containers, hand hygiene, and really encouraging them to stay in that designated area and not interact with others in the congregate settings until they get transportation to the quarantine and isolation site. Again, symptomatic patients should be treated according to the local procedures, but there may be certain situations where you need to get someone urgent medical attention. So if someone looks like they are truly in imminent danger, if they have warning signs such as trouble breathing, persistent pain or pressure in the chest, if they look confused in a way that's not consistent with their baseline, if it looks like they are having trouble staying awake, or if they have any bluish lips or skin of the face, definitely just call 911 immediately instead of calling CAM or waiting for transportation to the quarantine shelter. I'll go over this just very briefly since, again, you have that designated quarantine facility that is handling the isolation and quarantine practices. But sometimes people may ask you how long they have to be isolated. So if someone is symptomatic, we would like to wait until at least 10 days have passed since the symptoms appeared, and that the client has not had a fever for at least 24 hours without taking fever-reducing medications, and any other symptoms have improved. If you have a client who had a positive test but never felt sick from it, then we would still wait at least 10 days have passed since the first positive COVID-19 RT-PCR test, and that the person has not developed any symptoms since then. There are certain situations with people who have weakened immune systems where you might have to extend the duration of isolation to up to 20 days. Those are individual cases where you would want to consult with infection control experts. And again, in your local case, that would be a decision that would most likely be handled at the quarantine shelter. The CDC no longer recommends a test-based strategy to end isolation, except in certain cases where you have people with severely weakened immune systems. And that would be a decision to be done in consultation with infectious disease experts. So now in the remaining time, I'd like to just say a few words about cleaning and disinfection. We want to make sure that when you're cleaning, that you're doing so in a safe way. We recommend wearing disposable gloves to clean and disinfect, and any additional PPE that might be required based on the products that are being used. We want to clean and disinfect frequently touched surfaces, so things like shared tables, chairs, doorknobs, light switches, the rails on the staircases, telephones, computer keyboards, or anything else that many people are touching. So one resource I'd like to highlight for you is the EPA's List N. The EPA has a list of household disinfectants that are approved to use, which are known to kill the COVID-19 virus. And this is pretty useful to make sure that whatever you're using is actually effective. So some examples we can think of include if you get a donation of cleaning products to your facility, you might want to check this website and make sure that it is something that really works against COVID. I'll show you that site in just a moment, but first I'll also just say a few words about bleach. So if you're not using one of these commercial products, you can also use a dilute bleach solution to disinfect. Now, most household bleach contains 5% to 9% sodium hypochlorite. So we recommend just using normal, regular household bleach, and don't use a bleach product if the percentage is not in this range, such as some types of laundry bleach or products for industrial use might not be appropriate for disinfection. We do want to remind you that when you're mixing the bleach with water, make sure that it is diluted properly. You want the solution to be strong enough to kill the germs, but also dilute enough to be safe to use. It might be very tempting to just eyeball it. If you have a mop bucket, to just pour in what you think might be a sufficient amount for the water in there. But we really do recommend actually measuring the amount of water and bleach to make sure that your final solution is made appropriately. Very often, if you buy a commercial bleach product like Clorox, the container itself will have directions for how to prepare a solution. But if your bottle does not have the directions, the recipe is 5 tablespoons or 1/3 of a cup of bleach per gallon of room temperature water. Or if you're making a smaller batch, it's 4 teaspoons per quart. So again, 5 tablespoons or 1/3 cup per gallon or 4 teaspoons per quart.
Hey, how are you? Your wallet is right here.
If you're using a mop bucket or other container, it might be helpful to figure out a consistent recipe. So you might want to just make it like this the first time, make a mark on your bucket to see how much water it is, and just figure out a more efficient way to mix it up consistently every time. It should go without saying that you should follow the manufacturer's application instructions for any product that you're using. If you don't have specific instructions when you're using a diluted bleach solution, you want to leave the bleach on the surface for at least 1 minute before removing or wiping. So this is known as the contact time that is required to actually kill the virus. And the surface should remain visibly wet during this time. If you're using disinfecting products, also ensure that you have proper ventilation before, during, and after application, such as opening the windows. And if you're using bleach, remember, never mix household bleach with any other cleaners or disinfectants. If you mix it with ammonia, you can create chloramine gas, or if you mix it with any kinds of acids like toilet bowl cleaners or even vinegar, you can release chlorine gas. And these vapors can be very dangerous to breathe in. Sometimes there have been significant exposures associated with situations where people were not purposefully mixing the products, but sometimes people would wipe down a surface with bleach first and then follow it up with ammonia. And then just that back-to-back use can also create this kind of toxic gas. So I want to just show you this website. So this is the EPA's website, and this is the list of disinfectants. When you come to this homepage, there's this big blue button in the middle that says, click here to find a product to kill coronavirus. And when you click that, it launches this site that is more interactive. Let's see. Okay, so you can see here on the left side, oops. So this page has a tendency to scroll down automatically, but just scroll back up again. You can search a product by active ingredient, the site where you're using it. So you can select whether you're a healthcare facility, an institution, or residential facility. You can select the surface type that you want to use. So for example, if you have a surface like a dining table or a kitchen area that's going to come in contact with food and you're not able to rinse it, you would want to pick something like food contact, no rinse. If you have a porous surface, a surface that would absorb or hang on to water, then this tab can provide you with the proper products for it. You can search by contact time. You can browse all, or you can search by keyword. So if someone gives you a supply of Lysol, for example, you can come in here and type in the brand name and pull up all the different products that company manufactures and see if your specific product is on the list. So cleaning and disinfecting indoor areas is pretty important, but for outdoor areas such as patios or yards, they generally require routine cleaning, but they don't require widespread disinfection. It would make sense to clean and disinfect frequently touched surfaces. So again, if there are railings, grab bars, or door handles, we recommend disinfecting those. But if you have wooden surfaces such as benches, picnic tables, or ground covers, sidewalks, there really is no need to do anything specific for those areas. Actually, while we're on this topic, I will show you another website. During our site visits with the shelters, we also noticed that many of you have indoor play areas for children. And we want to make sure that we address that concern as well. So children may be more likely to come in contact with various surfaces or put things in their mouths. So we want to make sure that any disinfectant that is used in the playrooms is safe for use by referring to the EPA list N. Actually, alcohol is probably one of the safest substances to use in those settings because it evaporates and leaves no residue. But again, if you go back to the EPA list for disinfectants that are safe for non-porous food contact surfaces that do not require rinsing, you can see that many of these are alcohol-based products. So on the CDC site here, if you can look at the website, we do have guidance on cleaning and disinfecting areas where children may congregate. And this is actually under the guidance for schools and childcare facilities. So if you want to find more detailed information about this, it would be under this section of the website rather than the homeless services section. And finally, there is an organization called Caring for Our Children. And this organization provides national standards for cleaning, sanitizing, and disinfection of educational facilities for kids. So you can see this is their guidance here. The CDC does link to this website as well from our site. So this is something that has been vetted, that is a reputable source of information. So it even goes over cleaning and sanitizing things that go into the mouth, like pacifiers and thermometers and small teething toys. So finally, just to go over a few reminders for staff protection. I know we've hit a lot of different subjects this morning, but again, we just want to remind everyone to maintain good hand hygiene, maintain your physical distancing from each other, and wear masks consistently. It is very easy to become complacent since we've been told to do this so many times. It's easy to feel tired of it, but it really is important. So to summarize, of the things that we've discussed today, there are a few things that you might consider implementing. We want to encourage you to perform regular symptom screening of all of your residents. If you're just able to speak with each person at least once a day, make sure they're not feeling sick, go over the symptoms with them using a standardized tool like the CAM intake form or whatever you choose to use that really can help us contain the spread of COVID-19 in our community. Continue to practice social and physical distancing, and we recognize that it can be hard when so many people are living together, and sometimes you might need to give frequent gentle reminders. Continue wearing masks around other people, and I would recommend educating the shelter clients about ways to improve the fit of masks, such as the ones we went over earlier, either by wearing a cloth mask over the paper surgical mask or by doing the knot and tuck trick. Make sure that any disinfecting products that you're using are products that are known to kill the SARS-CoV-2 virus. So you can use EPA's List N to look that up. And again, if you're using bleach solutions, make sure that you are diluting them properly and replacing them after 24 hours. The mop water is not good after 24 hours sitting out. And definitely don't mix bleach solutions with other cleaning products. And the very last thing is I want to remind you that the CDC has educational materials such as flyers and signs that you can put up in the facility. One thing that some of us noticed on some of our visits is that there is still outdated signage that is still hanging up in some places. We found some signs that still say things like don't travel to China, or mask wearing is not recommended at this time. So I would just take the time to go through the facility and make sure there isn't a lot of redundant signage and nothing that's out of date. As I mentioned earlier, I will send out an email with links to up-to-date guidance as well as some signage that you might find helpful. So we just recommend that you use consistent materials, whether they come from us at the CDC, the local health department, or other sources that you may choose to use. I think it's exciting that at your next call, you're going over educational materials for vaccination as well. So for example, at this point with the mask signage, just about everyone knows it's important to wear a mask, but maybe posting something about when to wear it, how to wear it properly, and how to improve the fit of the masks might actually be more helpful. And again, with the signage, more is not always better. You might want to be mindful that if there's too much stuff hanging on the walls, people might start to tune it out. So just focus on having a few highly visible signs in heavily trafficked areas that people might actually pay attention to. So with that, this is the material that I have to present. I'd like to just offer some time for any questions or comments or open discussion. So thank you very much.
Thank you, Michael. All right, so I know we've only got about 2 minutes left. So folks, feel free to ask questions or type questions in the chat. We can stay on a few extra minutes if that works for folks in case you have some questions. But if you need to hop off, then feel free to hop off as well. This webinar is recorded and we will post it as well. So thank you again so much, Michael, for coming and speaking to us. And I'll stop talking now in case other folks have questions.
Dr. Ye, your colleagues gave my team an excellent presentation on ventilation. Do you have a few quick tips for the shelters on things to look at on ventilation?
Again, I would say ventilation is not my area of expertise as a clinician. Certainly, we recognize that many facilities are limited by what they have. I know some people don't have forced air in the buildings, have radiant heat, or have windows. We would just say to try to, if you are able to create negative pressure in the areas where you might have to isolate patients, that would be ideal. But we also recognize that's probably not always feasible for many shelters. So I would say also for disinfection to make sure that you are getting adequate ventilation when you're doing the disinfecting. The fumes, the vapors from bleach and ammonia or other products can be pretty noxious. And even after your nose gets used to it, with time, it is still irritating to have around. So we certainly would just recommend opening the windows or whatever you can do to increase air circulation as much as possible. If you have specific questions about how to do that, I think I would have to defer to our subject matter expert on our team for ventilation. And Katie, if I send you an email with links to documents that we discussed today, would you be able to distribute that to everybody?
Yes, I can absolutely do that.
Okay, that would be great.
Yeah, thank you. That would be great. All right, folks, any other questions before we hop off of here? I'm not
Yeah,
seeing
and again,
any other questions
I know I've
come
said this
in.
already, but yeah, we're just really impressed with all the good work that everyone's doing in the community. So it's very encouraging to see all that.
Thank you. We really appreciate that. We know everyone here has been working really hard to keep clients safe. And so kudos to all of you guys. I feel like that's exciting to hear from the CDC that we're doing well. So thank you. And thank you everybody on this call for all the hard work that you guys are doing to keep clients safe. We appreciate you guys. If you have any questions, feel free to reach out. I will make sure to forward the materials from Michael to all of you guys. So thanks again and happy Friday. Hope you guys have a great weekend.